welcome back to Vivian's series on the Horizon in Healthcare. My name is Dr. Beth Brooks, and I'm the registered nurse, and I've been working with the team on Vivian to create these short videos about what's going on in healthcare and what are some of the strategies that you might think implementing in your recruitment process. And today I want to talk specifically about the American Nurses Foundation's workplace pulse surveys, which is a bit of a mouthful. But beginning back in COVID, at the beginning of COVID, the American Nurses Foundation, which is sort of the umbrella, one of the organizations in the American Nurses Association, began doing pulse surveys around a myriad of topics during COVID. How were organizations handling PPE? How were organizations mental health, assessing the mental health of our nursing workforce? And so these surveys have been coming out since early 2020. And so from these results, we're really getting a very good understanding of what's going on out in the working world of nurses. And in particular, there are some significant findings that I think are really, really important for our HR and nursing leadership teams to be thinking about as we start to build back our nursing workforce. Or in Vivian's case, we have a large database of nurses who used to travel who are very interested in coming back to permanent work. So how do we understand what that experience was like during the pandemic? And now what are some of the strategies that will help you rebuild back your nursing workforce? So as I said, that first survey started in 2020. We've looked at health and wellness. We've looked at the work environment, looked at whether nurses were vaccinated, looked at what was the availability of PPE. So there's been about a dozen surveys now over time. And I know I'm probably a little particular, but I tend to gravitate towards studies with and information that comes from large survey samples. Quite often there's a lot of stuff, information out in the marketplace right now about what's going on in the nursing profession, or who's leaving the profession, who's leaving their position. And it's sometimes very hard to decipher that information. So going to a source like the American Nurses Association that had 11,000 nurses respond to these questions gives one a much better sense of what's going on in the market. And as we say, in the scientific world, those findings are more generalizable to your organization than some of the findings we have from much smaller studies. So as I said, we know from these 11,000 respondents, and for sake of comparison purposes, 58% of these nurses worked primarily in acute care, and 73% of them were at the bedside. So this is not managers, this is not advanced practice nurses, this is the nurses at the bedside. And I think the other thing that's really important to keep in mind is we did lose 100,000 nurses that left the workforce during the pandemic, primarily because the workload and quite frankly, the lack of childcare. And it became really difficult for nurses to manage working and their family life. So we've had 100,000 nurses leave the job market. We now have to start recruiting students back into colleges, and then recruiting nurses back into our organizations. And of those 100,000 nurses that left the job market, they're primarily under the age of 35 or between the ages of 35 and 49. So everybody thought that all the nurses that left the workforce during COVID were our nurses nearing retirement. And in fact, there was a couple of studies now that have come out, and those are the least burnt out and the least stressed from the pandemic are our more senior nurses. And it's our nurses under the age of 49 that were much more impacted by the pandemic. So the other couple things that came out in the workplace pulse survey from the American Nurses Association, no surprise when I say that staffing was a significant issue, but also expertise. Nurses, we were short-staffed nearly everywhere and in nearly every part of the country and every organization. But the nurses who responded to the survey said half of the time we didn't have the right skill mix of nurses on the unit. So we might have had, that mismatch between the complexity gap, which then makes the work more difficult for everyone. Many, many nurses reported being not allowed to take PTO or vacation time. So you can imagine what that does to senses of burnout or stress and fatigue. 59% of the nurses during COVID were asked to work an extra shift, work beyond their schedule. Most 72% of the time, we did not have enough ancillary staff on our units. And 30% of the nurses that were working did not feel prepared to practice on their own. And I think that certainly speaks to how many new graduates and young nurses that COVID was their first real experience with a clinical environment. And you can only imagine, and I've anecdotally heard stories about how challenging that is for a new nurse to constantly be in an environment where it's intensely acuity and having so many patients die. So it was just obviously not the best work environment. From a mental health perspective, we learned from the survey that the nurses feeling supported by their organization dropped tremendously, and also not feeling heard by their organization dropped to 2.7 out of 5 on this positive environment scale that the Nurses Association used. And then, so did my organization support me? The results were 2.9 out of 5. And then did my organization respond to my complaints or concerns? 2.7 out of 5. So that's doesn't bode well. And so we certainly have some work to do. For the most part, nurses only said 38% of the time that we had a healthy work environment. So again, we have some work now to rebuild some of the mental health and support and stress reduction programs in our organizations. And I think the most disturbing and maybe not surprising was how much bullying, incivility, and violence these nurses experienced. And it was 9 times out of 10. Well, I should say, well, no, 9 times out of 10, it was patients and families, mostly patients. 90% of patients perpetrated violence in the organization against a nurse. Sometimes it was families. And that 65% of the nurses working in hospitals reported bullying and incivility at work. And then 40% of those nurses in the hospitals experienced violence. And quite frankly, this is unheard of. Certainly, nursing, we've had issues in the past with peer-to-peer bullying, but to have patients and families react in such a powerful way against nurses has really been very traumatizing for nurses. So it's something for us to be thinking about. And we also had an uptick in incivility from physicians and bullying from physicians. So I think that's certainly speaks to the stress that everyone was under, but it also speaks to some interventions we need in our organizations to make our work environments safer. So the big question from this particular study, again, of 11,000 nurses, nearly half, so 49%, indicated that they would be intended, not for certain, but intended to leave their position in the next year. So we have a total of 49%, half of the nurses are thinking of leaving their position. 19% are saying within 6 months, and the other 30% are saying within the year. So huge thing, huge consideration for your organization to be thinking about. This is probably the time to be doing some, pulse surveys or some internal assessments of how your teams are doing. I suppose the good news, certainly the good news is that we're not seeing the dire predictions that some of the news stories have been reporting about nurses leaving the profession. The one empirical study, scientific study I've seen indicated about 10% of nurses are considering leaving the profession, but not their position. So you have to be sort of a wise consumer of that data when you see some of those reports, and making sure that you understand, are they talking about leaving the position or leaving the profession? So I think it's good to understand what we're up against, because we do have a lot of work to do to create or recreate really healthy work environments for our staff. No nurse should be in fear for their life at work. I mean, it just can't happen. We know there's been a couple of incidences most recently about gun violence in hospitals. So it's a very real concern. So here's some things to think about. What's your organization doing around anti-violence, anti-bullying, no tolerance policies for any kind of incivility? So that's the first sort of piece that HR can be really helpful with. I would say number one, or I should have said number one, is salaries. The nurses are definitely feeling undercompensated for what they've been through. And our data here at Vivian Health shows that travel nurses are looking for $65 an hour, is what they would consider a good salary to come back into a permanent role after having done some traveling. So I think reassessing all that compensation is going to be a really important strategy moving forward. And then I would say, from this data in particular, genuinely listening and genuinely empathizing with what nurses have been through. Many of the nurses in the ANA study indicated that sometimes their organization didn't even ask them, how are they doing? Like, how are you doing today? And so making those extra efforts to be out and talking to the staff and genuinely listening. And then once you begin really to actively hire, one of the things that we do here at Vivian Health is we have clinical advocates, which are nurses, which pre-screen some of the candidates that are interested in working for you, so that they've already done a little bit of that legwork on the front end. So when that candidate comes into your inbox, we know, that that's someone who's interested in working for your organization. And oh, by the way, it will speed up the hiring process. So think about the hiring process. How smooth is that running? Genuinely listening and empathy on units and leaders. That authentic leadership. It's nurses know, staff know, and that came through in the survey data when it's not authentic listening. So something to be considering. Any type of magnet-like environment attributes to rebuild. I know some hospitals suspended some of their shared governance and suspended some of their activities around magnet during COVID. And then there were others that really even did more. So what's your organization doing to sort of reinvigorate that or reestablish those magnet-like work environment attributes? And then just, I think, anything around leadership development and certainly staffing and scheduling. And I'll be talking about that in an upcoming webinar, about using some newer techniques to look at how we do staffing to try to be more precise, and so that staff understand exactly what their work will be, because it's very unsettling to not know when you get to work where or who you might be working with. And then I think last, just really remember that RNs need to be feeling physically and psychologically safe. And so what can your organization do to ensure that the staff are safe? So I hope you enjoyed hearing a little bit about what's been coming out of the surveys from the American Nurses Association. We have certainly learned a lot. There's certainly actionable information here. So I want to thank you for joining us. And if you are interested in receiving the citations or a copy of the survey, or have questions, please just let us know. And you can find us at hire.vivian.com. And thank you.